look out. So our last presenter is a gentleman that I've had the pleasure to meet over the past year. We actually worked together in Michigan Urgent Care. And this guy, as a physician's assistant, is just phenomenal in urgent care. People love him. I think some people actually get sick so they could come and see him, which is a little interesting to me. Yeah, just a phenomenal guy. And so we asked him, you know, they're doing some interesting things here at the Huda Clinic, which he may comment on. But what really touched me is they began to grow vegetables. They have it kind of cordoned off by disease states, which I thought was very interesting. And after we have lunch, we're going to have the we're going to walk over there. So his name is Qadri, but we call him Q. So where'd he go? The guy is like, you know, in his fatigues and his ninja uniform, blending in with the environment. We call him Q. Please come on up. Would you put your hands together? And welcome. Thank you so much, sir.
How you doing, sir?
I'm doing very well.
All right. Thank you very much, Dr. Blessman. Thank you for that exaggerated introduction. Appreciate it. Hello, everybody. My name is Q. My actual name is Babar Qadri. People call me Q. The young kids call me Dr. Babar, but I'm a physician assistant. Been such for about 6 years now. I started in home health care, then I went to family practice, then I went to orthopedics, and I then came into urgent care, working with my mentor, Dr. Blessman. The transition that I made when I was going through all those different aspects of medicine, I noticed that there was one commonality that all patients were, I don't want to say suffering from, but were exposed to. And one of those commonalities were they were just being treated for the symptoms of these diseases majority of the times versus actually trying to help reverse the disease. Socrates, who is the father of modern medicine, had said, treat food as thy medicine and medicine as thy food. A lot of times what we do is instead of food, we replace that with chemicals such as medications or prescription pills. My job, my goal, my desire is to, what I like to say, and I'm sure everybody's heard this, you can teach a man how to fish and he eats for a lifetime. As opposed to feeding him a fish, he eats for a day. So what we try to do at the Huda Clinic, and as the educational director there, my job is to teach students when they come in, all the stuff they learn from their medical schools and the books and everything is great, but they really don't learn much about nutrition. They don't learn much about what certain foods can help actually decrease the issue of chronic diseases, or foods can actually help reverse chronic diseases, which I'll get into in a minute. But my job is to make sure that we teach not only the students, but patients alike how to fish. Twofold reasons for that. One, it's a selfish reason because when I teach patients and they're more educated, it makes my job a lot easier because they're not as sick and I just get to sit there and relax. Two is because now when we teach patients certain things that they're doing or certain things that they're not doing in their life that are contributing to these disease states, and we educate them on that, it allows them to now take control of their health. It allows them to now be more conscious of certain things that they're doing or certain things that they're not doing, so this way that they can control their health and get better. My goal is to make sure patients get off of these medications and learn that medications are only temporary. They're not permanent. They're only as permanent as you make them. Of course, certain situations outstanding. So at the Huda Clinic, we see patients that don't have insurance, underinsured, or have no insurance. We see them for free. We don't charge them a penny, but we just want to take care of their health. So as I was working at the Huda Clinic, we were seeing patients and they were coming in and they had these health issues, but majority of the times the docs would just give them these prescriptions, tell them, hey, you can't eat this, you can't eat that, I'll see you in a month. Patient walks out of the clinic like, I got this pill, doctor told me not to eat this stuff, but he gave me this pill because I have this high blood pressure because I ate this stuff, so if I take this pill, I can still eat this stuff and not worry about my high blood pressure. So this is the mindset that a lot of patients have been getting into or have gotten into. Our job is to tell them these medications are there only to help relieve the symptomology of your disease state that's being caused by your lifestyle habit or your lack of certain lifestyle habits. Does that make sense? So this is the progression of mind frame that we want to put them in. So when they come to the Huda clinic, they're already at a disadvantage because they don't have insurance, so they can't get these prescriptions. If we write them one, they're so expensive at the stores, they're going to choose either food or medication. You best believe they're going to choose food. Problem is, the food that you get to choose here is not so good, and it increases your disease state. So it's a wheel that we have to kind of kick in and break. So what we're trying to do at the Huda clinic, along with the Huda Urban Garden, which is where I'm coming from, so forgive me for looking all dirty, but I'm playing in the dirt. That's what I love to do. We teach the patient, this is your disease state. This is how you got to your disease state. So now we know what to avoid. But if I'm going to take all these foods off of their table, you best believe I have to give them choices to put some foods on their table. How many times have you walked out of your doctor's office and he said, you can't have this, you can't have that, you can't have this, you can't have that. See you next month. Like, all right, now what do I eat? You took everything off my plate. So here's how I do it. I tell my patients, and I can say this in my sleep, no fried food, no fast food, no fatty food, nothing that's fake food, nothing that comes in boxes or cans. Please do not drink pop. Do not have any sugary kind of foods or drinks. Don't eat late at night. Go to sleep a little bit hungry. Make sure you get 60 ounces of warm or room temperature water every day, 30 minutes of cardio. This is what I tell every patient. So when a patient says, whoa, you just took all this food off my plate, I'm waiting for them to say that. Because I grab them by the hand and I'll say, come on with me, let's go to the garden and I'll tell you exactly what you can replace this food with. So if patients have high blood pressure or patients have COPD, difficulty with breathing and asthma, we'll take them over to the section of the garden that has eggplants, that has dandelion root tea, that has sunflower seeds. Things of these natures may help patients get into a better healthy state because all of these foods have perfective and what I like to say, detoxing effects. For example, dandelion root tea or anything bitter helps detoxify the lungs, or the liver, sorry. So if you're detoxifying the liver, you're actually purifying your blood. Now to increase your blood supply that's clean and good, I'll give the patient some rhubarbs, or I'll give them some beets, or give them some kale. This way they can eat these foods, and not only now are they purifying themselves, but they're actually helping decrease their disease state. Does that make sense? So what we do is we'll tell the patient, here's your disease, here's how we got to this disease, and here's how we can change it. We're taking all this stuff off, but here's the other foods that we can put on. So we have a huge packet that we always give patients at the Huda Clinic that always, I tell them, stuff your fridge with this. Anytime you go to grab something out of the fridge, not only is it tasty and healthy for you, but it serves a medical purpose for your chronic disease or your chronic state. So in conjunction with a lot of other gardens, we have, Lindsay's an awesome resource. This lady is amazing. She's helped us out with the Huda Garden from day one by giving us a whole bunch of crops, education, as well as volunteers. Buckets of Rain, they've helped us as well. General Motors, they've all helped donate to this garden. So we have this community garden, and what we like to do is all the foods that we grow at this community garden, all these foods are for patients first because it's their medicine. Anything left over, we end up giving to the community, or we'll give to the soup kitchen at the Muslim Center. Anything left over from that, we try to donate to other restaurants or organizations that can use them. So it's a pretty simple procedure, but I'm proud to say that we are one of the only few clinics in the country that has this kind of business model, where we treat the patients for free, but also provide them with the Socrates model of food as thy medicine. We try to go around to small community centers and build gardens for them so that the kids can learn. One of the things that I have been criticized about is that I don't have an irrigation system in my garden. I purposely don't want an irrigation system in my garden because I want the volunteers, who are mainly kids, to come through with watering cans and water each plant so they get back in touch with it. Because a lot of times people see this food on their table and they don't appreciate really where it came from or what it's really about. So if we can get their fingers back in the dirt and see the growth production, it allows these kids to respect it more. And not only are they seeing it, but we're also teaching them how to fish. So now we've gone into the movement of food sovereignty and food stability. And that's one of the things that we also try to do. We have a program called Crates for Kids, where we put a crop in a crate, like a milk crate, and we give it to the kids, the neighbors around here, and they just grow them on their porch. So now they can feed their family tomatoes from this crate, or carrots, or whatever they decide to pick up. So there's a lot of programs that we have going on, but our main focus is educating patients on how to eat healthier and educating patients on how they got to where they got and what we need to avoid perpetuating their disease state. So right now, today, actually, we have our 4th General Farmers Meeting where we're having our kickoff right now. We got tons of volunteers out there, and they're moving the soil, they're planting the crops, they're getting everything set up. I invite all of you to come check it out. You're more than welcome. We'll be there till 4 o'clock. Get some fresh, I call it black gold because it's the purest of the pure dirt. Get some fresh gold underneath your fingernails and help us plant out there. You guys are more than welcome. Thank you very much. My name is Q. Again, hudaurbangarden.org. You guys are more than welcome to check us out anytime. Don't be a stranger. Thank you very much. Thanks for coming out. God bless. I think we have questions.
Thank you very much. He did say dirt. You're not supposed to say dirt, man. I'm told that's politically incorrect. You got to say soil.
Soil or compost?
There you go.
I called it black gold.
Yeah, black gold. Okay, that's good. We have questions? Yes. We need a mic over here? Yes. Awesome.
Can you hear me?
Yes, we can.
Oh, okay. First of all, Q, I want to thank you for your commitment, your community commitment, and your bravery in the face of what the medical community considers opposition. I thank you for that. I work at a health food store, and I am amazed at how many people are coming in self-diagnosing and self-treating without the education that they need to know that it starts from what they're putting into their bodies. But I admire the fact that they're trying to turn that around. So it's starting there in the gardening aspect, and it's coming through your working in the medical community trying to get them back where they need to be. When they come in the health food store, we try to redirect them into their eating and stuff. So I really thank you for that. Thank you for the information today. Thank you so much.
All right. Yes. We got a question. She gets a question, every speaker right here. You get the award for the most questions asked.
Is that the cruise?
Yeah, the cruise. That's yours.
I would like to know because a lot of what you said are some things that I'm dealing with, and you only see uninsured individuals.
Correct.
So,
But, I mean, if you're here, we can sit down and we can rap for as long as you want to figure out what we got to do.
okay, thank you.
I'm telling you, this guy is phenomenal. People get sick just to see him. Yes. We got one more question.
Okay.
Nobody gets paid. The clinic is run strictly by donations from the community. Yeah, it's completely community-based clinic.
Straight up love. That's what runs the clinic.
Yes,
Straight up love. There's a question here.
Will you come to other community group? We have lots of groups going on in the city. So will you come to lots of community meetings?
I would love to.
Okay.
I would love to. As long as my wife says okay.
Better get permission for sure. We have one more. No? So let me say one thing because this is such an important issue, and I just want to emphasize. I want just a little reality for you. You know, if I cut you, your body will send in platelets to stop the bleeding. It will send in white cells to stop the infection. It'll send in fibroblasts to scar that thing down. And the beauty of that is that you will not have had to make one decision. Your body has a wisdom to find its way back to wholeness. But you can create two mistakes. You can create like what I call an error of omission, so your body says, hey, we need some vitamin C down here. Well, we don't have any. Well, that's what we need. Well, I don't know what to tell you because we ain't got none. That's the error of omission. Or error of commission is I keep putting my hands on the side of that and I keep spreading it apart. Okay, that's the body experiencing something that it shouldn't experience. Error of commission. Now, errors of omission are worse than errors of commission because if I keep spreading it apart, it still will heal. It just will take longer. You end up with a bigger scar. But if you don't have the nutrients in place, I can put a stitch in it and it won't put itself back together. So when you have problems, you have disease, you got to ask yourself, what is my error of omission? What is my error of commission? You figure that out, your body will find its way back. Does that make sense? Amen. Okay, thank you very much. Another round for Q. The guy is fantastic. Really. It is such an honor to work with this guy. He is, I'm just telling you. When I grow up, I want to be just like him. Okay.